Good afternoon. I'm Brennan Decima, owner of Decima Wealth Consulting. With Medicare open enrollment coming up this weekend, it's bringing up a lot of questions about healthcare coverage in retirement. Now, if you're a Pfizer colleague, chances are you might have heard of the Pfizer Retiree Medical Plan and the Retiree Medical Subsidy. So, this video, we're going to cover what the plan is, how it works, and really just make sure you understand how it coordinates with Medicare. So, I'm going to share my screen here. So today we're going to talk about the key considerations for Pfizer colleagues that are eligible for the plan. So we'll cover, retirement healthcare cost. We're going to go over the plan itself. We'll talk about how the subsidy works. We'll talk about how it coordinates with Medicare, and then what happens in the event that you pass away. So healthcare is one of the biggest unknowns in retirement. There's a lot of different variables. It depends on when you retire, how long that retirement is, how long you live, and then your own personal ailments and individual health needs. But Fidelity recently did a study, and they have they have determined that a 65-year-old couple that retires in 2025 is expected to pay over $345,000 towards healthcare cost in retirement. Now, this is essentially more than doubled since the survey started back in 2002. So in 23 years, we've seen healthcare costs just skyrocket. So Pfizer, fortunately for retirement eligible colleagues, offers a really, really wonderful benefit to help alleviate some of that healthcare cost in retirement. So, how do you cover healthcare in retirement? So, there's a number of different ways to do it. So, the first way is when you initially leave the company, whether that is retirement, separation, termination, you have the ability to access Cobra, and Cobra is continuation of your existing coverage, and that's available for up to 18 months after you leave Pfizer. Now, you can go out and look at individual insurance. So that's, you go to healthcare.gov and you look at the state offering. If you're under 65, if you're over 65, that's where Medicare kicks in. If your spouse is still working, maybe you're eligible for their group plan, or you may leave Pfizer and go to a different company and have access to their new employer plan. And then for eligible colleagues, you've got Pfizer Retiree Medical, which allows you to keep your continual coverage and keep your comprehensive plan in place. So with the Pfizer Retiree Medical, um, you can begin coverage as soon as you retire, but you do have the option to defer enrollment. So if you decide to defer enrollment, you do need to have some existing coverage along the way. So you can't have a gap. Uh, you can enroll down the road, but you've got to have coverage the whole time. So if you go more than 31 days without coverage, you're going to see your eligibility for the Pfizer Retiree Medical disappear. So the first is continuation of your Pfizer medical coverage. And the second is for certain colleagues, the retiree medical subsidy. So that's something Pfizer contributes to their share of the cost to really knock down your out of pocket substantially if you're eligible. So, really, really nice benefit. Now, one thing to be aware of here, let's say you do enroll in the Pfizer retiree medical. You leave the company, you enroll in the plan. And then 2, 3 years later, you decide to go work for another company and they've got a great insurance program and it's a lower cost. Well, be aware that if you enroll in the Pfizer Retiree Medical, you cannot opt out and opt back in. So, in that scenario, if you go to another employer and you leave the Pfizer Retiree Medical, you don't have the ability to re-enroll down the road. So, just really, really important to be aware of. So, again, before you opt in, make sure that that is the best choice because you can defer it. Uh, just something to be aware of there. So, what are the eligibility requirements? So, at retirement, Pfizer colleagues, you have to satisfy one or both of these eligibility requirements. So, if you want the full coverage, but also receive the subsidy where Pfizer is contributing a portion of that out of pocket, you need to be over the age of 55 and you need to have at least 15 years of service after the age of 40. Now, you can still have access to the coverage but not receive the subsidy. And essentially you need to be over 50 with 10 years of service and your age and years of service needs to be 65 or greater. So again, for the RMS, you need to be 55 with at least 15 years of service after 40. For the retiree medical without the subsidy, um, over 50, 10 years of service, and age plus years of service need to be greater than 65. When you turn 65, Medicare kicks in. So this is a really, really common question a lot of our clients ask us. Medicare can be a little bit confusing with all the different parts and advantage plans, supplement plans. So if you do have questions about that or how IRMA impacts the premiums, uh, send us a message, visit us to schedule a complimentary appointment, www.decimawealth.com. But let's say you turn 65 while you're still employed with Pfizer. There is no action needed. So you do have the ability to delay Medicare enrollment until you retire. Just best practice there. If you are planning to retire and you're after the age of 65, you want to enroll in Medicare within 3 months of leaving Pfizer. If you're after 65. But if you turn 65 while still employed, Pfizer's coverage still remains your primary coverage. So really nothing you need to do until you're about to retire. Let's say you leave Pfizer before you're 65 and then down the road you turn 65. So you're required to enroll in Medicare Part A and Part B. You need to do that within 3 months of turning 65 or Medicare imposes a penalty. And just something to be aware of, if you don't enroll in it, Pfizer may increase your premium cost on the retirement medical plan if you don't enroll in time. So just be sensitive to that. Best practice is just within 3 months of 65, if you're retired, start that Medicare process. So let's talk about the subsidy and how it works. So if you are under 65 and you're enrolled in the Pfizer Retirement Medical Plan, Pfizer's going to pay 75% of the retiree's cost and 50% of eligible dependents' cost. If you're over 65, they pay 85% of the retiree cost and 70% of the dependent cost. So again, a really large chunk of that out-of-pocket coverage cost is picked up by Pfizer. So eligibility for this is a really, really powerful benefit, but it's designed to pick up the bulk of Pfizer's cost towards the plan. There are some key considerations. So you do have a portion of your monthly payment that you're going to owe. So Pfizer's covering their cost, but you still have your cost. You're responsible for paying all of your contributions to the insurance, any copays, any deductibles. So that is key. It's still an out-of-pocket cost. Once the RMS is depleted, then the full cost is owed for the coverage by the retired colleague. And then something that I get asked often is, hey, can I put the balance of that towards other healthcare costs? So this is a notional account. There's no ability to withdraw cash. You can't use it towards other health insurance or healthcare costs. This account can be only used towards the Pfizer Retiree Medical Plan. So just really, really important to be aware of that. So how do you calculate your subsidy balance? So this is based on your years of service after you turn 40 and whether or not you're married at the time of separation or retirement. So if you're not married, if you're individual, you take your years of service after 40. Now remember, it needs to be at least 15 years, and you multiply that times 8,200, and that's going to be your balance for the RMS. Now, that cannot be any higher than 25. So minimum of 15, maximum of 25. So if you've worked, let's say you're not married, you retire, you've worked for Pfizer for 40 years, well, you're capped at 25. It would be 8,200 times 25 for your RMS balance. Now, if you're married, It's 11,000 times years of service, but the same criteria is there. You can't have any more than 25 years of service towards the RMS. Now, if you happen to pass away, what happens to the retiree medical coverage? So if you're an active colleague, but you've already met the eligibility requirement, your eligible dependents can still enroll in the plan. They're going to be responsible for their share of the monthly premium. They're still going to be eligible for your subsidy. Um, so again, if you're active and you've met eligibility, your family, if they're eligible, can still enroll. If you're retired and enrolled, well, coverage is going to continue for your eligible surviving dependents. So they're going to keep that coverage. But if you don't have any dependents, that balance just is forfeited. It's not like it's going to go to a charity or, non-eligible dependents. So common example of that is, let's say you have adult children, you still have 100,000 in the RMS. They're not eligible dependents. Let's say you have a 40-year-old kid, right? 40-year-old heir. They're not on your plan. They're not an eligible dependent. They're not going to receive the balance of the RMS. That is forfeited. Now, let's say you have a child that's under the age of 26. They're still on your plan. Well, they can continue that plan and continue to use the RMS. Spouse can continue to use the plan. So if there's a non-eligible dependent and there's still a balance of it, it is forfeited. So hopefully that is helpful. So I know this is a lot. If you need additional support, you can schedule a complimentary evaluation at www.decimawealth.com. We do have some other videos on some of the Pfizer benefits. We primarily work with Pfizer colleagues. So if you have any questions about the plan or how the benefits fit into your overall financial picture, we'd love to meet with you to see if we're a good fit. Hopefully this is helpful. Have a great day.